Fibrosis. In this session, we shall learn about how fibrosis can be interpreted in chest X-ray. There can be two kinds of fibrosis. There can be a post-infectious fibrosis, commonly occurring in tuberculosis, where one particular lobe might be fibrosed, usually apical area. And then there is a diffuse fibrosis that happens in interstitial lung disease. In this session, we'll just focus on this fibrosis that happens in the infectious etiology. So the key findings is that the fibrotic tissue replaces the parenchyma. So the lung parenchyma has this alveoli with the air coming from the trachea, the airways and other structures, and if there is an infectious insult, slowly all this lung parenchyma is converted into a is replaced by a fibrotic tissue, and this fibrotic tissue will look white in the chest X-ray, white with reduced volume. So there will be a volume loss, and the trachea will be pulled to this side of this fibrosis. There might be parenchymal destruction because of this thing, and the septal thickening will be there, which is quite dense, and there will be architectural distortion and traction bronchiectasis because of the pulling of the fibrotic bands. Sometimes even the diaphragm might be pulled up because of this fibrotic bands and volume loss. So this is the first X-ray here. So basically there is a fibrosis up here. So fibrosis with patch. So why I'm saying fibrosis is some sort of dense white opacities are seen. And second thing is the trachea is quite pulled to this right side, right? This is a fibrotic band, and you can see this kind of pulling effect because of this fibrosis happening. Even this diaphragm is a little bit pulled up because of this fibrosis. So there is a volume loss here, and the trachea is pulled up here. So even this some sort of pulling effect is happening. So this is a fibrosis, and since it is in an apical area, most likely it's post-infectious, post-TB fibrosis. So here again you have this whiteness here, some whiteness here, right? So this is typical of bilateral apical fibrosis. So whenever you see this kind of white shadows in the top, in the apex, consider fibrosis. Here the trachea is in midline because both sides you have this pulling effect, so that it is in the neutral area. In this X-ray again, look at this thing, so white, and this trachea is also pulled up here, the side, the right side. So there are some fibrotic bands up here, so this is also a fibrosis. So likely this is a fibrocavity. This is some sort of a cavitation because some air is there, some space is there. So other areas are like fibrosed, and you can see that the trachea is shifted to the right side, and then you can see this area, this is all fibrosis. So parenchymal fibrosis is here, right? It has completely destroyed this lung, but here there is some element of fibrosis here. Again, similar X-ray. So here it's fibrosis, trachea is shifted to the side, so you see that the lung volume is reduced. This diaphragm, this area is lifted. This is, they say it is because of this fibrotic bands here, they're just getting pulled up. This is called the juxtaphrenic peak sign. Juxtaphrenic peak sign, that the tenting of the diaphragm is happening here. So another notable thing is because of this fibrosis and volume loss, you can see that the cardiac shadow is pulled towards the side, because this is the left side and this is the right side. Normally cardiac shadow should come somewhere here. If the lung is okay, then there's no issues, so it should be in the left side with the apex somewhere up here. Now this entire thing has been shifted to this side, right? The lung is quite visible till this space. So that is because of this fibrosis, it has pulled up the mediastinum. So fibrosis, it will pull the trachea, pull the mediastinum, and also this there will be a scoliosis of the spine. There will be a curvature of the spine where both the lower part and the upper part will be pulled towards that fibrotic side, and this looks like a bow sort of thing. While you examine the patient, actually there will be drooping of shoulder, volume loss on the side, and all these features. And probably there is a compensatory emphysema on the opposite side, this left side, because there is volume loss and fibrosis here. So this is a typical picture. So mostly in certain countries where TB is quite prevalent, these out of x-rays are also quite common in medical colleges. Again, you have bilateral fibrosis, bilateral apical fibrosis, and here you see all these things are fibrotic bands. Looks really bad, x-ray, and patient seems to be on ventilator support. If you see in this area, you can identify an endotracheal tube. So he's on ventilator support, and this is fibrosis, this is dense fibrosis, and then there are fibrotic bands. The whole lung is looking very bad. So whenever you encounter dense white parenchymal shadows with volume loss, traction bronchiectasis, then you have to consider as a possible fibrosis. Thank you.